So now here I'm going to do a manual ventilation via a oral airway or ET tube. So first is I'm going to check the patient chart and then ensure that I was able to get important details. Then once I'm inside, I will always ensure that I will wear appropriate gloving or any PP such as gown, face shield, goggles to prevent from any contamination. And then after that, we will also introduce ourselves, especially to the healthcare providers present, that we are here to guide and also give appropriate ventilation as being a respiratory therapist. And then after is we always assess the patient, check the vital signs and everything, their level of consciousness. And then when the ET tube or oral airway is placed, we always check if we have the ambu bag in place, and then we also check the connections present if there are no any leaks or defects. And once we sense that it's good to use, we have to set the flow, insert it, and then set it at around 15 liters per minute. And then before inserting it, we also have to check the reservoir bag if it's properly inflated. That also, so we noticed there was a kink, so good thing we also have to check that one because of the sound. So after that, we position ourselves in the patient's head, and then it should be a head to chin lift, and then we insert it correctly like that, and then we should apply a breath for about 12 to 20 breaths. And then assuming we notice, especially if it's ET tube in place, there should be like a tape or anything that would secure the ET tube. We should also make sure that our hands are holding this one when giving breaths like that, to prevent from any accidental like being moved around in the patient's oral. And then we also have to ensure that the balloon is properly inflated. And then when giving manual breaths, we also check the chest rise. We should not always give too much because it might lead to a gastric inflation, especially in their stomach. And then we only should give 12 to 20 breaths. And then when we already did those correctly, and the mechanical ventilator is ready for patient's use, we always have to check and also ensure that it's being inserted with a capnography also to ensure their end-tidal CO2, and then prior to hooking by the mechanical ventilator. So another thing when doing the manual ventilation for ET tube is not just for looking at the patient's chest rise, but also we should also include auscultating in order to hear if the ET tube was properly inserted, so that if we notice that it was like for example there was diminished on this side, we should either pull it up a little bit and then adjust the lip level and then reassess again their ventilation. So once done, we have to turn this flow back to zero, then it should be secured in the same place, especially if it needs to be used again in emergency cases. And then we should always have to ensure that we would always assess the patient, obtain vital signs, and after that remove the PPE, and then we should always document what we were doing to the patient. I think that's